Well, first of all, the risk factor for stroke, ischemic heart disease, and dementia are the same, exactly the same. High blood pressure, you know them. So if diseases occur together, they should be treated together. They pose a risk for each other. In other words, if you have a heart attack, you're more likely to have a stroke or become demented. If you're demented, you're more likely to have a stroke. If you have a stroke, you're more likely to have heart disease or get demented. So if they're risk of all three, why not look at them together? And if we join forces, the people interested in the brain and the heart and dementia get together, we can go much further faster. So in the Wurtemberg lecture, which I gave to the Academy a couple of years ago, that's precisely what I'm advocating, that we should do it together because there is economies of scale. And also we should focus it not on scaring people, saying, look, unless you eat healthy and exercise, etc., you'll have a stroke in 20 years. Well, that doesn't work. I mean, it doesn't work. It's too far in the future. So the emphasis has to be on brain health, meaning not only your intellect, your ability to think, but also your emotions and your social life. The pandemic has pointed out that they're very closely connected. If you're depressed, you're not going to perform very well. And if you are anxious, you're not going to perform very well. And again, if your cognition, your abilities, your intellect is failing, you're going to get depressed. And we know what solitude and isolation have done. So we have to look at brain health as being all three. And we have to foster it. They're relatively simple things that can be done to have a healthy lifestyle. For example, exercise. People think exercise going to the gym. Well, it turns out that any exercise is better than none. And you get most of the value by doing some modest thing you can work into your habits. So we need to go from easy to hard and not have a big program that nobody follows.